and Tara. That's Chapman, Dawson, and Nate. And my name is Libby, and we'll be talking about what we have going on today. First, we'll discuss a little bit about our community and where the demographics have projected us into an organization and what collaborations we have drawing from there. So first, about our community, we are located in Middleborough and Jasper. We have land in Jasper, shown by these red circles. So Nate wants to talk about demographics.
Just a few things about the population research that we've done. As you can tell, most of Middleborough County has stayed pretty stagnant except for Jasper, and that's an area that we want to look into and expand into. The other interesting part about that is most of Hillsborough County is actually predominantly 25 to 44, which is probably because of the influx of young people into the Jasper market. Some other conditions and some issues that are prevalent in Hillsborough County, the top 5 causes of death: heart disease, cancer, cerebrovascular disease, chronic respiratory disease, and all other accidents. The other big issue is over 2/3 of Hillsborough County is obese or overweight. This affects all type of medical care and causes comorbidity, or is a major comorbidity. The other big issue in Hillsborough County is the rise in CMS insurance or no insurance at all. And also as jobs and manufacturing jobs have left Hillsborough County, so has private insurance slightly started to go down as they were the main provider of health plans. And I'll let Pranitha talk about our organization.
Chapman and I will be giving the overview of our organization. Our mission is to serve the patients and the families within the Hillsborough County and in their healthcare needs. As you can see, January will be our 64th anniversary of operation. We started off as a single specialty private practice group, and we expanded into a multi-specialty and subspecialty private practice by 1972. We opened a facility in Middleborough in 1955, and due to the population shift into Jasper, in 2002 we opened a facility there as well as updated our Middleborough location. January 15th of this year, we opened an ambulatory surgical center within the basement of our Jasper facility. As you can see, these are our 2 facilities. Middleborough is approximately 20 years old, whereas Jasper is about 13 years old, and that's where we house our ambulatory surgical center. Chapman?
All right, so before we get into collaboration with Dawson, just want to give you all a basic overview of our current operations. This is a breakdown of our 40 physicians. As you can see, 2/3 of them, or 1/3, I'm sorry, are in pediatrics and internal medicine currently, and over half of them are currently located in the Middleborough facility, but we are expecting those numbers to change. As far as growth goes, as Nate mentioned, high obesity rate, high percentage of the population is in that middle age group from 25 to 44. So we are hoping to capture them as far as internal medicine goes, capture them for the long term. And also with pediatrics, we feel like that category will be having children, and we also have the OBGYN care there. This is just a basic breakdown of services that we do offer at both facilities. As you can see, pediatrics, internal medicine, and OBGYN are our top 3 at Middleborough. And then for the Jasper location, as I mentioned earlier, it's pediatrics, OBGYN, and cardiology. For the revenue and payers, 50% is private payers, and we do accept all insurances, and the other half is Medicare and Medicaid. Net revenue, obviously it's increased from just over $33 million in 2012 to right under $38 million in 2014, and we're hoping to see that number continue to rise with our partnerships in Jasper.
So moving forward, we will continue to offer the services that we're currently offering to our patients. In addition, we have strategically created partnerships that will allow us to align our mission with the needs of the community. So Dawson and I, we will talk a little bit more about the collaborations that we are partnering with. So, Medical Associates, we have decided to partner with Middleborough Community Hospital. Well, former Middleborough Community Hospital is now known as Hillsborough County Health System. In this collaboration with integrating the EMR, benefits include things such as the quality and convenience. As far as quality and convenience, physicians will have decision support because with decision support, physicians will have access to information as far as treatment guidelines. Also, there will be clinical alerts where physicians will have alerts for orders and also alerts for when laboratory tests are actually submitted to the portal for the physicians. Patient participation, this system will allow patients access to their health records. Also, we will have the ability to coordinate care, which is a plus for us as far as integrating the EMR, because with coordination of care, we can help as far as coordinating care between the hospital and the physician practice. This basically helps with the continuum of care within the community. And as far as practice efficiencies, integrating the EMR will help with decreasing time-intensive tasks such as prescribing drugs. And with this, the EMR will allow the physicians to e-prescribe drugs to the patients.
Before I talk about one of our other collaborations, I just wanted to bring to your attention our inpatient productivity. And here you see two charts, patient days and discharges. We break down inpatient productivity into the two locations where our physicians are admitting from, Middleborough and Jasper. And within each chart, you can see how many patients were admitted into the Hillsborough health systems, Webster and Middleborough Community Health. And in the green here, you'll see where we've sent them out to Capital City General. So, taking a look, if you look here, you see about 2,000, you'll see here some of the discharges right here, and that's about 65% of our admissions we send out to Capital City General. Given this small cross-section of data from the Jasper population, as well as our expectation that the Jasper community is fairly similar to the Middleborough community, and given that the interstate should be completed soon, we expect the population growth to rapidly accelerate. And so we believe that it's time that Jasper has a hospital, an inpatient center, or an inpatient care center. So as Tara mentioned, we embarked on a journey to connect our health information with the Middleborough Community Hospital. During those collaborations, we felt like we had a similar vision for healthcare in the Hillsborough County, an integrated network as well. And so we started with the information systems, but we believe that we could work together on building a hospital in Jasper. Here you can see some of the points as well. There's a lot to hammer out with things with different parties like regulatory agencies, tax attorneys, the management teams of both facilities, as well as the board members. We believe that we would like to start small and model our growth after Middleborough Community Hospital's facility in Middleborough and where they started. The initial phase would start at 50 beds. They started at 4, so we're thinking we'd start small. And as the community continues to grow, we can expand to meet the population growth. And as Nate said earlier, with the influx with our age demographics being between 25 and 44, there's a young child bearing age there as well, and among adults, and our maybe young adults as well, maybe playing sports and stuff, that we can take advantage of some of the surgeries. We've already seen success in our surgical facility our outpatient surgical facility in Jasper. I think that's it. Yeah.
Well, you can just click on the next one.
Yeah.
So in summary, we are in a really good prime position to continue managing our primary care services, both by continuing the operations in Middleborough and expanding and extending our services into Jasper. This in turn will manage the population health, ensuring that patient care providers have the information needed for that continuum of care, and improving the access really just by relocating and expanding in our Jasper facility. So this will ensure our future viability and be a trusted provider for both communities. So now we can open it up for questions.
All right.
All right, I'll start. Let me start first with your partnership to build the medical center in Jasper. Where is that going to be built in Jasper?
We currently have a land option for 225 acres that's adjacent to our facility and to the new interstate highway, so it'll be located on the new interstate highway.
So it'll be close to your current.
It's adjacent to
Facility.
both, yeah, it's in between the interstate, the new interstate and our current facility, for 225 acres.
And will you offer any inpatient surgical services at the new facility?
Yes.
Will that impact your outpatient surgery facility that you have?
Still hashing it out. The plan was to actually relocate the ambulatory services we have, that operation, and move it into the hospital.
And then I just have a question about the EHR. You currently have a robust EHR system, correct? And they also have a separate system. And you're going to integrate those two? And- Go
Go
right
ahead. We plan to integrate both systems, have the same software. In Middleborough, Hillsbury County Health System, they will manage and operate the system. They'll actually own the software that we would use for integration.
Okay, so it's the same software or it's different software?
It will be the same.
Okay, you're going to make
Hillsborough,
it the same.
yes, we are,
Who's going to pay for it?
hospital.
I didn't see that. I want to say, I appreciate, I like that y'all had a mission statement. I thought that was great. I really like the memorandum of agreement that we got. I thought that was helpful, so thank you.
He's the endeavor.
Those are all the questions.
And I like what you said about aligning your MA's vision with contributing to the health of the community. I guess one question is you guys did a really good job with the graphs, and one that I saw was regarding I guess how happy your providers are, peds, internal medicine, and was there one more? The OB? OB. I'm just wondering how does that address the population health? I didn't see any issues with. You made a really good point saying that I guess the demographics of the area, but was there a defined need in the chapter about MA about is there a high mortality for babies, kids falling and breaking their leg a lot playing sports? I just didn't see the support behind building a new facility and putting half of your staff that can supply services to this demographic. Like, why do that?
I think part of it was the graph that we showed that part of our missions were going to Capital City. So those people are having to travel from Jasper to Capital City. So why not capture that market right there, keep them there?
So it's an access to care issue.
From our perspective, yes.
Also, there is no hospital
looks like the uninsured are kind of creeping up a little bit. So how do you intend to sort of manage your payer mix in the turmoil of this changing environment, with this uninsured number creeping up a bit?
I think, I take that. I think part of how we can manage that actually is the benefit of having the interstate between Jasper and Capital City. As the residents of Capital City are able to travel, it's going to be a commuter town. And so they're most likely employed. They'll move out to Jasper and they'll have better insurance to their employers as well. So while we see that creeping up now, as Jasper's population mix improves, those numbers should actually increase as the insured population.
Maybe I missed something in the presentation. I mean, did a nice job providing an overall, but what is the benefit of this collaboration with the hospital? How is that going to benefit MA? I'm not clear on this.
I think we're still hammering it out, but we're gonna, there's gonna be a distribution
Of what?
from the hospital.
From the hospital. I think you can put something.
They're hashing it out.
I would do that. But that, okay, so, but you're already, or on that one graph you gave us, when you talked about the inpatient, the blue, the green was the patients that went to Capital City, was that,
Yeah. The green was the patients that went out of Jasper and Capital City.
okay, but your physicians are still servicing those patients, correct?
Yes.
Okay, so even if they move into this new Jasper hospital, I mean, they're still getting the inpatient, rates and so forth. So again, I'm just not sure how MA is going to benefit from it, since they already have the patients.
Assuming we get over the legal ramifications of this partnership, the benefit to us is more long-term. In the short term, these patients could come back to this facility or to this community, right? In the long term, we're preparing for the larger growth in Jasper. Jasper's already almost the same size as Middleborough. And I assume that the pathology of Jasper would be similar to the Middleborough community. And so we could eventually grow that facility into something similar to the Middleborough Community Hospital over the next 10 years possibly. But we start small to see where it's going. There's also some operational efficiencies that are due to this. Our Jasper physicians are servicing these patients at Capital City General. They get to save on windshield time. You know, they don't have to drive back and forth often. They can manage their outpatient clinic schedules better too, so we can see some gains on our outpatient clinics as well.
And would you have, is there ability to increase your outpatient services?
Yes, there should be.
I mean, if they have this extra time, you know, I mean, will you have more patients? I mean, are you at
We
maximum?
are estimating that as well.
What I'm saying, are you already at maximum capacity